And so our first speaker is Dr. Doug Oman. Dr. Doug Oman is an adjunct professor where his research focuses on influences on health from spirituality and related psychological factors. He has taught public health students in community health sciences, as well as maternal child health and other areas of public health. He edited Why Religion and Spirituality Matter for Public Health, which is published in 2018 and is available through Springer, and is the director of UC Berkeley's trainership on spirituality and public health. I'm just going to add a little remix because this short bio is very indicative of the humility with which Dr. Doug Oman walks. But Dr. Doug Oman is doing an amazing amount of research. He really is sort of decolonizing the research and education field when it comes to spirituality and public health. Not only is he a published author, but he will be speaking a bit on some of the projects that he is doing that are then really doing systems change. So please give Dr. Doug Oman a very warm welcome. Thank you.
Thank you, Lauren. I'm very humbled by this introduction and very grateful to be here among so many people doing such wonderful work in the community. Can everybody hear me? Okay, good. Yeah, thank you. Yeah, I have some slides here. I think of myself as sort of an ivory tower person compared with all of you doing work. So I'm going to be talking more in kind of general terms, though, as Lauren was mentioning, I have done some more specific work in related to maternal child health, but for now I'm going to be just kind of introducing, maybe you could call it a general framework that I think other people's ideas might fit into. And so my outline here is that first I'll say just a little bit, well, where is public health regarding spirituality? Because in some sense, maybe I'm the only academic public health person here. Reverend Dr. English is very much in the public health system, but I sort of am dealing with where we're training new generations of public health professionals, that sort of thing. And then I'll talk a little bit about the Stakeholder Project, which is some of my current work, and then just a few words about application. So where is the, only see, don't see the full title there, so some of the slide must be getting cut off. Anyway, where is it regarding spirituality? That's hidden part of the title. Oh, anyway. Computers keep us on our toes. Well, there does seem to be, in the field of public health, there is an emerging recognition. There are a couple of books. Lauren was mentioning my book there on the right, came out 2018. There's also a book by Ellen Eidler of Emory University. So it's her title is more succinct and memorable, Religion as a Social Determinant of Health. Anyway, it is getting into the literature, but it's still not very far integrated. And the field of public health has a very mixed history of partnering with faith communities, as I imagine many people here in this room know from their own experience, that sometimes the public health system is pretty obtuse, and it will just come to people in faith communities and say, can we have access to your population? And that's sometimes called faith place, because there's no interaction, there's no taking on board dialogue with the culture, no collaboration. But other times, maybe an impulse towards emanates from within the faith community, that's more faith-based, or at other times still there's collaborative. Maybe collaborative can be the best. So this is maybe some language for the very mixed track record to public health. We want to encourage more collaboration rather than the others. And currently, unfortunately, there's little pre-service or in-service training in spirituality and religion in most schools of public health, though there is some talk that the COVID pandemic maybe has been kind of a wake-up call for that. So also, well, when you look at all this from a scientific point of view, which is kind of the native language of public health as a profession, well, what are these pathways to health? I think this duplicates some of what Pam King was saying earlier this morning. there are some generic pathways by which faith communities do give strength and health to people, things like social support, also encouraging good health behaviors, not smoking, things like that, and having an environment where you're among others who are not smoking. And then supports for mental health, which Dr. King went into a good deal. Then maybe there are some distinctive pathways, which I think was also being talked about. Spiritual and religious methods of coping. There are just certain things that a faith tradition gives you that, the Lord gives, the Lord takes away, blessed be the name of the Lord. Ways of bouncing back, ways of being resilient. Other distinctive methods that, as they show up in the scientific literature, include things like sanctification of specific facets of life or engaging in spiritual strivings. Okay, so that's just how this one sort of prickly partner, the public health system, looks, how it can look at things. Now, what is the work that I've been doing the last couple of years through Berkeley? We have a funded project here. We call it the Stakeholder Project. Its goals are to improve the public health profession and system, but not only in schools of public health, but training, pre-service training, public health workforce, local to national, and then even the research could use some improvement. We want to improve the understanding of spiritual and religious factors as well as the skills in partnering with faith communities. And as part of doing this, we're doing quite a number of interviews with people who've been doing exemplary work. I got Reverend Dr. English to agree over lunchtime that she would be one of my future interviewees. So a productive lunch. And so what are some of the things that they're telling us? Some of the recurring things that they're telling us are to have the spiritual and religious leaders at the table from the beginning so that it's not, already baked into some particular place. Maybe it'd end up in some of the same place, but at least having them there part of the conversation from the beginning. Maybe very often it would end up in a different place than it might if the public health people were just by themselves. And be in community, go to the community events, build relationships. Probably have regular meetings beforehand. Don't wait for a crisis. We learned that in COVID, right? Have regular, maybe monthly meetings, maybe quarterly. Anyway, something that works for a community. And don't just instrumentalize. That's another way of saying don't just do faith in place, or don't just do faith place, do collaborative. Okay, and then, what happened? And then application. Well, what does this mean in practice? Well, it's almost just rephrasing some of those same ideas. But let's forget those overall policies that we want to have. Not everything has to do with spirituality and religion. Just support communities in general. Like, don't have food deserts. Your basic social and economic policies that that you can talk about without even talking about faith, but then also have those spiritual and religious leaders at the table from the beginning. And then maybe this is more cutting edge, more delicate, how do government and faith relate to each other? Sensitive stuff, but sort of on the frontier of, can you make the social environments all over the place? In different sectors of society, like clinics, psychiatry, make them more welcoming to spirituality and religion. If you go to a mental health professional, do you have to be afraid that, if you say you're a person of faith, that they'll think it's a disease or something, So make social environments all over more welcoming. And so, and one way that might be scientifically talked about is supporting identity safety across all social environments in many places across all sectors of society. So that's all I have to say in my opening remark. Thank you.
Doug?